Over the last 24 hours, we have identified 1,345 new cases of COVID-19 and completed about 13,100 tests. We have now identified 816 additional cases of variants of concern in the last 24 hours. Variants currently represent about 57% of our active cases. In Alberta, the B117 strain is now the dominant strain, meaning transmission is much easier and can happen faster than ever before. We are also seeing growth of P1 cases with community transmission in many parts of the province. Our positivity rate currently stands at 10.4%. There are now active alerts or outbreaks in 567 schools, which represents 23% of all schools in the province. Yesterday, Fort McMurray Public and Catholic school boards moved grades 7 to 12 online until April 30th. To complement the switch to online learning, all extracurricular, youth sport, recreational, and performance activities for those ages are now required to either take place outdoors or be paused in Fort McMurray for the same 2-week period. I would like to remind all Albertans that it is important that we all continue to follow public health measures inside and outside of the classroom. Hospitalizations continue to rise. There are now 476 people in hospital being treated for COVID-19, including 105 in the ICU. Sadly, 5 new deaths were reported to Alberta Health in the last 24 hours. I extend my condolences to their loved ones and to anyone who is grieving today. Each death is a loss for our province and a reminder of the continued importance of containing this virus. I have heard some questions about the timing of second doses for vaccines, so I want to clear up any confusion. Due to limited supply, as you know, we extended the interval between the first and second doses for all vaccines to a maximum of 16 weeks. However, once we finish offering first doses to all Albertans 16 and over, we will start second doses as soon as our supply allows. This will likely be in later June, based on our current supply estimates. So if you have had a first dose, please do not yet call your pharmacy or AHS to book your second dose. It will take a few more months to get enough supply for both first doses for everyone and to begin second doses. There are now 3 vaccines being offered at sites around the province, and I know that some people may wonder if this means they can choose their vaccine. As I've said, all 3 vaccines are effective at preventing illness and severe illness. I encourage eligible Albertans to take the first vaccine that they are able to get. We are not making a distinction between Pfizer and Moderna vaccines, as both vaccines use the same technology and have performed identically in clinical trials and real-world effectiveness studies. AHS clinics are using one or the other of these vaccines for those currently in eligible 2C and earlier groups. So those who go to AHS clinics will not be able to choose which of the 2 vaccines they wish to receive there. The one choice that is available for Albertans who are eligible only for AstraZeneca right now is to either choose to take this vaccine now or wait for an mRNA vaccine. mRNA vaccines, the Moderna or Pfizer, would be available approximately 3 to 4 weeks from now for those aged 50 to 64, and approximately 4 to 6 weeks from now for those aged 40 to 49.
We're going to monitor the numbers very closely over the course of the next week, because it would typically take 2 to 3 weeks for us to see a result from additional restrictions. And so what we're watching for right now is the potential increase of cases coming from Easter gatherings that might have happened a little over 2 weeks ago. And at the same time, we're watching to see if the additional public health measures have limited spread. So those are 2 things we'll be watching for very closely in the numbers over the next week or 2. What I can tell you is that while we are continue to be very concerned about these high numbers, 1,400 cases a day at this point, the rate of growth seems to have come down a little bit. So it's too early to take that to the bank. You know, we really, look, the timing is so critical right now. We now have a quarter of adult Albertans vaccinated. We figure about 10% of the population has some kind of natural protection through having prior infection. And so we're by 2 to 3 weeks from now, we're going to start to see a very significant number of Albertans with some protection. The most important thing there is, because we've prioritized the most vulnerable in the vaccine rollout, we hopefully will see a shrinking percentage of people who get infected ending up in hospital. But it's still very critical. All we need to do is look at what's happening in Ontario. That is real. And if we don't all be careful, that could potentially happen in Alberta.